Hi everyone. Just checking in with you guys. I am post-op from my ACDF surgery C5-6 and C6-7. I just completed day 4. I'm going into day 5 right now. And I just wanted to check in with you guys just to kind of give you an update. If you want to follow me, you could subscribe right below. Just click on subscribe. And I do have a series of videos starting from Christmas time 2018 when I had my first real, more serious episode of pain. And then I made the series of videos about my choices and my surgeon and the types of procedures. So if you're someone that is thinking about having this surgery, or you know somebody that's going to have the surgery and you just want more information, you may want to follow me. I'm not a doctor, but I could just tell you my experience. I'm an average person. I'm 55 years old, dental hygienist, and I heal averagely. And so these videos may be able to help you. When I found out that I needed to have this surgery, or it was an option for me to have this surgery, I went ahead and Googled ACDF surgery, and I watched a lot of videos and got a lot of information. There were some videos that were really helpful, and there were some videos that were helpful, but I wish they had given some more details. And I just felt like I really needed some more details as far as information and how their recovery was and things like that. So I decided to go ahead and do a series of these videos. It's time consuming, but I know how important it was for me, so I'm hoping that even if there's just one person out there that could really benefit from my videos in making their decision or the choices that they need to make, it's totally worth the time and the effort put into this. So anyway, just real quick, so for about 10 years I was having like stiff necks, some pain and discomfort in my neck. And about 5 years ago, I started having this pain into my shoulder, and I thought I was having a shoulder issue because I'm a dental hygienist, so I'm always hunched over, arms up, scaling people hours a day, and I thought I was having shoulder issues, and so I was doing a lot of exercises and light weights for shoulder strength. And it did help, but it didn't help as much as I had anticipated. And then I started doing yoga, and the yoga seemed to help more. And I think the reason being is as I was strengthening my whole inner core in my body, it was also strengthening my neck muscles, which was giving my spine a little bit more support. And so that was helpful. But in the past, I've done chiropractic, massage therapy, acupuncture, and all of those helped temporarily, but I would always have these little episodes of a stiff neck, pain into my shoulder, down into my arm. And then probably about 4 years ago, I was having like tingling in my fingers, tingling in my arm a little bit, on and off. You know, it wasn't consistent every day, but I knew there was something going on. And I think I was just in a little bit of denial, like I'm fine, you know, I'll just rest more and I'll have more massages and I'll be fine. And so then Christmas 2018, right before Christmas, I had an episode that literally put me in bed. And I was like in so much pain, desperate pain. I wanted to go to the ER, but the area that I live in during the week to work, there's no really like surgeons down here, and I was a little bit nervous about going into the ER. And so anyway, I was laying in bed. It was about 1 in the morning, and I was so desperate. I really didn't know what to do. Just a lot of radiating pain, very nerve pain, like electrical shock, no relief, no matter what I did. And so anyway, on my phone, I just happened to have this surgeon's phone number, cell phone number he had given me when I was dealing with my mom a few years ago. And I remember saying, gosh, you know, if I ever had to have surgery, I would like this guy to be my surgeon. He seems pretty knowledgeable and pretty on it. And anyway, I remembered I had his cell phone number, and I'm thinking, oh no, I probably changed my phones twice since then. I don't know if it'd still be in my contact, and so I'm desperately looking through my cell phone, and he was on there. Oh my gosh. So I texted him, and I just told him that, you know, we had met a couple, 2-3 years before, and that he had given me his cell number, and I was in a lot of pain, and I did not want to just go into the ER and just see anyone, and I was really careful about who was going to be treating me and this and that. Anyway, he actually texted me back the next morning, and right away, you know, we became doctor-patient. He put me on steroids, got me some relief. Went in for an MRI and an x-ray, and it showed that C5, 6, and 7 were compressed and were pressing on my nerves. Actually, there was not even much disc left. The discs were bulging, and the vertebrae were pressing down together, pressing on my nerves, causing these pains down my arm. And I also have arthritis in there, and I also had bone spurs in there. And so he talked to me. He was an excellent surgeon, and he really talked to me. I think I can give his name today. So he is excellent, and he didn't push surgery. He's just like, Susan, you know what? You've got some issues going on with your neck, but you need to be ready for this kind of surgery. Like, you don't need to convince me that you need surgery. You need to be ready to do this type of surgery. So he sent me home, and I was a little disappointed because I really wanted a surgeon to say to me, oh my goodness, you have this going on, you need to have this done, be done with it. Like, I didn't have to make the choice, because one of the hardest things for me is making the choice, because I can tolerate a lot of pain. I mean, I've had natural childbirths and did fine with that, and so I know I can tolerate a lot of pain. So if a doctor told me I didn't need surgery and I was having a lot of pain, I could probably endure that. But I was just kind of getting tired of it affecting my daily life, because I didn't know if I was going to wake up one day and be really in pain and discomfort and just kind of stay home and relax, or if I was going to be able to go on hikes with my husband and my dog and go have fun. I actually made a couple trips and was miserable during those trips in pain. I just didn't know when the episodes were going to hit. I'd have these days of relief and then these days of severe pain. So the episodes were becoming more frequent. Like, over the last 10 years, it would happen like once a year, then it would happen twice a year, 2 or 3 times a year I'd have an episode. But when Christmas came and I had that big episode, it was like every week or so I'd have another episode. And finally, as far as pain level, I don't really like to take narcotics. I'm not really big on medications. I'm a holistic health practitioner as well as a dental hygienist, and I like to, you know, just do things more naturally. I don't like to put my liver and kidneys through a lot of issues, and that's just me. Although I'm smart, I'm not dumb. Medicine today is amazing, and there's no reason for us to be suffering severely and not take advantage of what's out there. So I just try to have a good balance. So anyway, I decided that I didn't want to live the rest of my life in pain, not knowing when. And I didn't want to live the rest of my life taking any type of medications. The one medication that helped me was gabapentin or Lyrica. And it's for nerve pain, and it's less addicting and stuff like that. And that really helped take that edge off and take that pain away and give me some relief. But I didn't want to live on that the rest of my life. I didn't want to live on Advil the rest of my life. And I wanted to be able to make plans to go hiking and do all the fun things that I do and not worry, oh, is that pain going to happen? Am I going to miss out? So finally, after it was 4 episodes after Christmas, 4 total, Christmas, and then 3 more episodes after that, I just finally texted the surgeon and said, I'm done. I need to have this. This pain is just unbearable. I mean, I have given natural births, and this pain down the arm, the excruciating electrical pain down the arm, to me, is worse than a natural birth for me. It is just bad because there was no relief and there was no option for relief. So at least during childbirth, yeah, it's a 10, it's a 10, it's a 10 as you're giving birth, but you know it's going to end pretty soon. Where this, I had no idea how long the episode was going to end. And so also, you know, with this whole nerve thing and my fingers being numb, I was worried that the longer those nerves were compressed, the less chance of me getting full recovery from the nerve. So that was another thing. It's like, okay, you know, I've had these episodes on and off for 10 years, but if I continue with these more frequent episodes and the more numbing that I have into my fingers and my thumb, I was worried that I would have nerve damage that could not be repaired. The other thing is I was starting to have pain down my spine, and I also was starting to have pain into my right shoulder, which I had never had before. Long story short, went ahead, decided to do the surgery. Pre-op, I did a few things before. I kind of cleaned my house and stuff and got things ready. I got some bendable straws that were helpful. Extra strength Tylenol, for sure, have that on hand. I'll tell you why in a little bit. Having a wedge and some pillow rolls from Bed Bath & Beyond. They have some of these pillow rolls that are like 20 bucks. I have one that's memory foam, a little bit firmer, and then one that's kind of softer. It's important to have both of those. These are like, you must have extra strength Tylenol, 2 pillow rolls for Bed Bath & Beyond, and a wedge. They have a couple choices of wedges. I got both. I got the one that was like a 5-inch and then one that was more like a 7-inch or 8-inch. Got both of those. Being comfortable is really important. If you have a recliner at home, you could probably do away with the wedges, but still have those rolls. Extra pillows. Have some soft foods around because you won't, be able to eat solid foods right away. And I'm trying to think what else is like so necessity. That's probably it right now as far as I would really want to have that. So the day before I couldn't eat past 10 o'clock. And you know what? I picked oatmeal because I didn't want to have like gut issues when I went in. And I picked oatmeal to eat from McDonald's just because we were on the road. And I picked McDonald's oatmeal with apples and raisins and stuff. And I don't know if they put preservatives in their apples, but the next morning I kind of had, kind of like this upset little diarrhea, gassy thing going on. I'm like, oh, that's just great. I hope nothing happens on the operating table. I was a little worried about that. But anyway, I got into surgery. They were so good. They kept me really comfortable. They sedated me as soon as they got me in the operating room. When I woke up, I stayed in the hospital. Actually, it was a surgery center. I stayed in the surgery center one night, and I highly recommend that. And the reason why, it's not that you're in severe pain, I can't stand it, I need to stay in the hospital, but you have support. Like, you have people that know what's going on. My husband's awesome. Don't get me wrong. He's awesome. He's a dentist. But the nurses, the RNs, the people on staff, they've seen this before. And so I was able to ask questions. They were able to keep me comfortable. They respected that I did not want narcotics unless it was absolutely necessary. I had a little bit of an issue with pain control, and part of that is because I really didn't want to be heavily sedated on pain medication, so that was my choice. And they respected that, and they worked with me, and they got me out of bed. I was doing really well. I was walking around. They got me out of bed right away. As soon as I had to, go to the restroom, they got me up, and they were giving me soft foods. The nurse went and got me these like really cool organic fruit popsicles that were amazing. And I was able to ask questions about my brace and this and that. So then the next morning, we had a 2-hour drive home, and my husband has a pretty nice Toyota Tundra truck, and I have a Prius, and I decided to use the truck because it's a little bit smoother than my Prius. My Prius is more to the ground. You could feel the bumps a little bit more, so I decided to use the truck. But I brought a wedge, and I brought a memory foam roll that really helped with the shock of the driving. So that's kind of important to have. So we came home, and the pain was there, but I'll be honest with you. The pain that I was having down the arm was a 10 plus. Honestly, it was like off the charts. I don't know what I'm going to do. I'm panicking. I would like stare at a wall and just kind of rock because I was in pain. The pain from the surgery is painful, but it's not the same kind of pain. It's a doable pain. It's a pain that is going to go away. It's a pain that you can take medication. Here, right on my table, there was medication. If I really wanted to take the medication, it was there. And it was more like most of the time a 7. While I was taking some medications for it, it would drop down to a 4. And maybe the 3rd day, it jumped to an 8 for a short period of time because of the swelling. It was kind of pressing on my neck and causing a little bit of discomfort. But it wasn't intolerable. Like, you could totally do this. If you've been suffering with this pain in your neck and down your arm, I'm telling you, if you've been suffering with that for a while, you can totally do this surgery. I'm being very honest with you, okay? The hardest day is the third/4th day, but it's not sharp, excruciating pain. It's more discomfort because all the anesthesia is worn off. You're starting to feel like kind of bruising a little bit in your body, where they've had to kind of manipulate your neck and your shoulders and your arms. You feel tender, and the swelling is kind of pressing on things, but it's not intolerable. As far as the sore throat, I expressed to my surgeon that I was concerned about the post-op pain. I was told him that's what my concern is. I wasn't concerned about him going in there and doing the surgery. I knew he would do a great job. But I was just concerned about the post-op pain and the swallowing and that kind of thing. And I think part of it is because I knew that I really didn't want to take a bunch of pain medications and all the side effects to that. I was willing to take it, but I think I knew that just my personality, I tend to not want to take it. So I was kind of, you know, concerned about it. So he was so respectful. Like, they put ice on it right away. They gave me in my IV this steroid, two or three steroid doses, just to kind of hit that inflammation just really quick to keep it from getting out of hand, which really helps. And they do that in dentistry, by the way. In oral surgery, my husband was telling me they'll do that. They'll zap a patient 1-2 times with a steroid dose, so they don't have to take steroids when they go home, and it really helps, you know, kind of control the inflammation. And the other thing is, they don't want you to keep taking the steroids because it's all about the fusion. And so in order for your bone to fuse around the surgery, which is what they really want, there's no ibuprofens, you know, anti-inflammatory medications, and no steroids, because it just really slows down that fusion process, and we don't want that. So that's about the surgery. And then today, I just completed day 4 at 7 a.m. and I'm into day 5, and I'm telling you, I'm better than I was day 3 and 4. The sore throat was not bad. Like, if I didn't talk, eat, or drink, didn't feel it. But as soon as I would drink water, or I would swallow, or I would talk, it felt tender. Now, I've had people say it felt like a strep throat type of sore throat. I've never had strep throat, but I can tell you that to me, it didn't feel that bad. I've never had strep throat, but I've heard strep throat is really painful. To me, it felt like a normal sore throat. Like if you were getting a cold and you had a sore throat, that's what it felt like. And, you know, when you have a sore throat and you go to drink something or eat something, it's kind of like you swallow and you kind of just tighten just a little bit because it's tender. But it wasn't like intolerable at all. I was so worried about that, and that was like not a big deal. And I'm going to thank my surgeon for that, because I really think that because of my concerns when I went in, I think their priority was my spine, don't get me wrong, but I do think they were mindful of, you know, how they handled me so I wouldn't have this excessive post-op pain. Still, when I swallow, you can see I can kind of pause and swallow, and it's more the where the surgery site is, you know, kind of like the muscles now. It's not the throat itself. Like, it doesn't hurt when I swallow food now, or if I swallow my medication. It's more just like the muscles contracting when you swallow. So that's why when I swallow and I'm talking and you can say, oh, that must hurt, it's just the contraction of the muscles that I'm feeling. And my throat still is a little bit raspy, and part of that is, you know, just them working around everything. So they made an incision in the front of my throat. They separated the muscles in my throat. They did put a tube down my throat to intubate me, to, you know, help me to breathe while I'm sedated. And then they went in and they cleaned out the old discs, they cleaned out the arthritis, they cleaned up the bone spurs, and then my surgeon took a cage. This is important. My surgeon took a cage. I did a bunch of research on this, so this is why it's important to me. There's different ways they can do this, and I wanted this to be done once. So my surgeon took these cages, and I'd like to get the name of the cage. There's different brands. I'd like to get the name of the cage that he used on me. But inside this cage, surgeons have an option of what they want to put in that cage. And it's a bone grafting material that helps your bone to kind of adhere to that bone, and then the bone fuses around the cage. That's the goal. So anyway, what he put in that cage is amazing. Okay, he put synthetic bone, he put cadaver bone, and then he took my hip bone and treated my hip bone. He took stuff off my iliac crest, and he treated it so that he got the stem cells from my hip bone. And then he put that in that cage too. See, a lot of doctors will use one or the other. They'll either use these discs to put in between the vertebrae to keep the space open. That's usually like a cadaver bone or synthetic bone, or they'll put a synthetic or cadaver bone in a cage, or they'll do the bone grafting and then they'll put a plate and then put screws in the plate to kind of hold those vertebrae together. But my surgeon chose to do cadaver bone, synthetic bone, my hip bone as stem cells in these cages, and then he placed the cages in between. and then he put screws in, and I do have pictures of that. And then I just heal around that, okay? And we want fusion to take place. Now, as far as this brace, he told me I could take it off at night, and he told me I could take it off when I'm eating, but I need to wear it all the time, every time else, no matter what. And honestly, I feel better with it on. When I take it off, I feel like my neck's not really supported. It just makes me really nervous. So when I have the brace on, I feel a little bit more supported, and I actually can rest a little bit in the brace. Now, I do know it's good to take the brace off and let your neck muscles work a little bit so your neck muscles don't get super weak. So I do take the brace off. So if I'm just sitting here and I'm talking to someone, I will go ahead and take it off and spend some time without it, and then I'll put it on. Last night, I really haven't been sleeping well. And that's been kind of weary for me because I really like to sleep. I know I need sleep to heal. And so I've been up on the wedges. So last night what I did is I took the bigger wedge off my bed and I put the 5 wedge on with a couple pillows. And then I laid down with the neck brace on and left the back on because the back kept my neck from collapsing. And so then I undid this and took the front off. I'll show you in just a second. So when I slept last night, I had the back laying between me and my pillows, and I felt like I had support. Plus, if I woke up, I felt like I could feel it, and it reminded me to be careful, because that was the other thing. I was worried about jerking in my sleep. I do weird things in my sleep. I'll just get up suddenly. And so I was worried about that. So I really liked leaving the back on. And then I did put the brace on in the middle of the night and turned on my side and laid on my side and got in a little bit more comfortable position. So I slept better. Finally got my pain managed. What I do is I've been taking 2 extra strength Tylenol every 6 hours. And then I take my antibiotic, which is every 6 hours. So that's what I'm taking now. That's it. And at the hospital, they did give me Percocets and they did give me muscle relaxers. I alternated it. I know they said I could have taken them at the same time, but I alternated it because I didn't want to get loopy and drowsy and didn't want to feel dizzy when I got up. I wanted to be able to get up and walk because that helps get rid of all the sedation and everything. And I didn't want to feel unwieldy. So anyway, I mean, I was in a little bit of discomfort at the hospital, but nothing, like I said, really bad. Most of the time is like a 6. Most of the time. And I got it down to a 4 when they'd give me the medication. And then when I came home the 3rd day, like the 2nd and 3rd day, I took the Percocets a little bit on and off. Didn't take the muscle relaxers. And then I finally weaned off the Percocets. I was taking a half. There was 1 every 8 hours, and I took a half every 4 hours, and that kind of kept the pain managed a little bit better. That was on the 3rd day. And then now I'm just doing the 2 Tylenol extra strength with the antibiotics that I'm taking. So let me show you. So anyway, you just undo it like this, and then take it off like that. Okay. And this is the surgery. I'm not supposed to take the bandage off at all until I see him. I had surgery on Tuesday, and today is Saturday. I see him on Monday. He didn't want me to take a shower, but I had to take a shower. So what I did was I just took a shower like from here down, and I had really like washed my hair really well. Like there's some shampoos that are a little bit more drying, and I washed my hair with that so it would really kind of strip my hair really well, so it would hold over for a few days. I will probably take a shower before I go see him on Monday. And what I did with my hip is I have Glad Saran and Seal. It's called Glad Saran Wrap and Seal. Anyway, and it sticks a little bit, but not really sticky. And I put it on my hip incision, and then I taped it. I had like a real gentle tape, gauze tape, and I taped it around that and just put a really good seal. So when I took a shower, I didn't like run water on it, but I took a shower. It did keep it dry, because when I took everything off, everything was dry under there. But anyway, I just soaped up and, you know, washed off and just felt better. Like I felt really better after my shower. So anyway, I think he's going to take this off on Monday. Excuse me. And then he will give me instructions on what to do with that, and I can let you guys know about that. After my surgery, I did have a little bit of problems. I had pain right here on my sternum, and I had problems like burping. And so it was kind of painful because I wanted to burp, but it kind of hurt. And that was like one of my complaints in the hospital. Hey, how are you feeling? I've got this pain right here and I need to burp. And so they did help me, like when I started eating. I guess it helps get the gases and everything moving. And when I started eating, I started burping more. And I did take a couple, I don't drink soda, but I did take a couple sips of a Coke, which helped. And after a couple days, that went away. It didn't get worse. It got better over time. And, but this is the back, like I said. So when I was laying down, it's pretty flat. When I was laying down, it just gave me that support. These little circles are on my occipital bones right here. And so I felt like laying on my pillow when I was laying, it just gave me that extra support. So I didn't feel like my neck was collapsing. And then also, if you're a girl and you have long hair, it's kind of a hassle, the whole hair thing in this, because it does get into the brace. It is kind of a pain. And I'm having a hard time still like reaching behind my head with both hands. Like I could do one or the other. But it's hard to just take both hands and do like a ponytail just yet. I feel like I'm pushing a little bit further than what my body's telling me I can do comfortably. So the hair thing is a little bit of an issue, but just do the best you can with that. I had wanted to straighten my hair. I have curly hair. And I had wanted to straighten it before I went in, but that didn't happen. But anyway, they don't want me to look up and down, so they definitely don't want me to extend up. She said, for sure, don't extend up. So there's been a couple times where I've looked down accidentally. I mean, if I come down from my hip and look forward, the nurse at the hospital told me I could do that. But a couple times I did look down, you know, kind of a little bit quickly to look at something. Maybe I dropped something, and it did make me feel a little uncomfortable. And I'm like, oh, I shouldn't do that. I turn a little bit left to right, a little bit, but not too much. I mean, if the doctor says I could sleep with this, without this, that tells me I can turn and move my head a little bit. Because if you're sleeping, I'm telling you, you're moving and turning a little bit. And so I'm not worried about it. I'm just trying to not overdo it so that I give my body time to reproduce that bone and get that really good fusion, because that's what we want to do. Another thing I wish people had mentioned on the videos is they never mentioned the details of what kind of surgery they had. So on my hip surgery, there's just a little puncture wound that they went in to take bone. I think he said 60 cc's of my bone. And so when I press on it, I could feel it a little bit. It is not achy. It's not causing me any pain. I don't want to say that's never going to bother me, because I know some people do complain about the hip, you know, removal of that bone. But it's not bothering me, and it's not hurting. I'm 55. I worry about, you know, my age and bone density, and I'm hoping that I don't have problems in that area. But I talked to my physical therapist extensively. I met with him before my surgery, and he told me there are things that they can do in physical therapy to kind of really help that, to keep it from getting scar tissue, which is usually what causes pain. And so I'm not too worried about it, just trying to keep it clean. And it still has the bandage over it, kind of like this. And I'm not going to mess with it. Keeping it dry, totally keeping it dry. I wear clean clothes, you know, we re-wear my pants or my shirts. I try to keep clean clothes on. I think that's it. As far as my post-surgery, I'm not having any pain down my arm. You know, I went in without any pain, or very little pain, when I went into surgery. So it's like, well, am I going to have an episode or not? Well, we'll find out if I have an episode. So right now I don't have any pain. If I get any type of little tingling, I know it's from the inflammation. It's, you know, because it's the same area that I was having inflammation and compressed nerves. So I'm going to have a little bit of that going on from the surgery. So there was one day, on the second day, I had both arms feel numb. And the surgeon had texted me, and I told him, I really think it's just from the inflammation. And he said, yeah, it's totally normal. There's going to be inflammation that's going to be pressing on those same nerves. And so, you know, I'm not worried about some of these little feelings that I'm getting. If I sit in a certain spot for a long period of time, my arm gets a little bit, you know, sore, might feel a little bit of numbness. But as soon as I start moving around, it goes away. So that's why I know it's just the inflammation. So I'm not too worried about that. But I can follow up with you guys and let you know. I can definitely feel a difference, like a difference. And also the surgeon said that when he went in there, they had a special doctor that put these electrodes or whatever on my head. I actually have scabs on my head didn't even know about it until I went to scratch my head. I'm like, what is that? I had a couple scabs on my head, and they put electrodes here and a couple other places, and I think the bottom of my foot, and they kept track of my nerves while the surgeon was doing the surgery, and they were able to see that my nerve compression came back 100%. So I'm so thankful. So that's why you don't want to wait until it's too long, because what happens usually is when they relieve the pressure off the nerves are still kind of compressed, and they hope that the nerve will bounce back and regenerate itself and come back, and a lot of times it does. But the less that you wait on that, the better, because you're gonna, you know, have better response to the nerve. So I'm really happy about that. I feel like, honestly, I didn't wait too long, and I feel like, honestly, I didn't not wait long enough. Like, I feel like the choice I made and when I made it was the perfect time for me. Even though I've had little episodes over the 10 years, it wasn't bad enough for me to say I need surgery or this type of extensive surgery. But yet, when the episodes got closer together and the pain got worse, I knew there was no turning back. There's not any chiropractor out there that's going to be able to undo that damage. There's no treatment out there. Seriously, if you're just fighting and spending all this money on all this other treatment, I think it's good to try it. I did the acupuncture, I did the chiropractor, I did the massages. I think it's fine to do that, but remember that that damage is there and it's gonna come back. I mean, it's not gonna just go away. And yes, those treatments do relieve pain and will give you some relief, but remember, as you get older, you know that it's gonna come back. It's not gonna go away until you fix the problem. So one of the things my surgeon talked to me about was having epidural injections, and I told him, I said, you know what, epidural injections, in my personal opinion, is just a cover-up. It's gonna get me out of pain, and it's gonna, you know, give me some relief for a while, but it's not gonna fix the problem, and that it's gonna come back. So that's where I am. It's like, if it's broken, we need to fix it. If it's broken and I can try these other treatments and it can postpone me 10 years, okay, great, I'm for that. And I did that. But when the episodes are closer and I'm having more issues down the arm, and I know that it's not going to get better, and any type of treatment is just going to be a temporary fix, any type of therapy is going to be a temporary fix, then I'm ready to fix it. So that's where my decision was, and I think it's kind of a common decision. So hopefully that will help you guys. Remember, subscribe, ask questions below. I do know from other people that told me they did videos, they encouraged me to do the videos. They told me that at first nobody responded, nobody looked at the videos, but over a period of years, I guess it pops up more on YouTube, and then the more people watch it, the more you pop up, and then they have like thousands and thousands of viewers watching it. So I know that probably one day there's going to be a lot of viewers, and I will do my best to pop on to YouTube at least several times a week to see if there's any questions on any of the videos, because I know I asked a couple questions on the videos and people responded right away, and I was very thankful, very, very thankful for that. So remember, very good surgeon, do your study as far as what type of procedure you want done, be ready to allow yourself to recover, know it's totally doable, know it's not any worse than the pain that you're originally having, and that's the amount of time of suffering. It's like, I know in 2 weeks I'm gonna be feeling pretty good, versus these episodes can last for months and years. Okay, my surgeon, his name is Dr. Ramin Rizadeh. That's R-A-M-I-N. His last name is R-A-I-S, okay, R-A-I-S-Z-A-D-E-H. Dr. Ramin Rizadeh is awesome. He has, I think, a brother that has the same last name, and I don't know too much about the brother, so I'm sure he's good, but I picked Dr. Ramin Rizadeh, and the reason why I picked him is, let me tell you, he doesn't know this, but I totally checked him out. He speaks in Canada, Australia, the United States. He speaks to orthopedic surgeons. He speaks to neurosurgeons. He's in his 50s. He's about the same age as I am. He knows what he's doing. He's done numerous amount of these, which is a key. I love how he's up to date on the different techniques. He's not all about what's new, what's greatest, let's do it. He's all about what's gold standard, what works, what has been stable. If something new comes out, it looks to me like he waits to make sure. My husband's that way in dentistry too. He waits to make sure before he does that. So he respects me. He respects my concerns. I'm not just another patient, another number. He is very professional. He demands a lot from his staff. His staff is organized. They're awesome. He's very thorough with my physical therapist. My physical therapist was telling me he's very detailed. I want physical therapy to start on this day, not before this day, but on this day. And so he's very good, and he cares about his patients. And he's very accessible. You can email him, because sometimes I don't want the nurse right now. I need to talk to the doctor. Like, I need to hear from the horse's mouth about this right now that I'm concerned about. And you can email him. He's great. So, and then the two hospitals that he works out of Alvarado Hospital in San Diego, and he works at the North County Surgery Center. He had me at the North County Surgery Center, which is really what I really wanted. I really wanted to go there, so that worked out. Very good surgery center, brand new, top notch, clean, just really good, very organized. So there you go. Keep track of your medications. Remember that, you know, kind of know what you're doing and what you're taking. Sometimes people say, well, take this, you know, many times a day, take that. Just, you know, keep track of it. What your doctor puts on the prescription is what you want to follow, okay, what your doctor says. Other than that, physical therapy, I live in Utah now, and I work in California. And so there's a physical therapist in Southern California. His name is Doug Wisdom. And he's very, very good. Same thing. I look at the age, you know, he's about my age, maybe a little bit older. Not much if he's much old. He's not much older. We're about the same age. But he's done this for a long time. And sorry. He's done this for a long time, and he's really, really good. And he addressed my concerns, and he's type A. And I am too. I like things perfect, and I like to know what's going on. And Dr. Rizaday is too, so that's why I fit in well with this office. So there's some names for you. I know people been asking me about the surgeon and the names, so there's some names for you. And remember, I'm not a doctor, so what I say isn't what you should do. You should always, you know, talk to your surgeon and go with that. But I'm just giving you my experience and what I've done as far as research and what I found is best for me and my choices and why I make those choices. And you guys have an awesome weekend. The weather is supposed to be amazing, and I will talk to you in a few days.